For the last 3 weeks, we've been talking about social distancing and responsibility. Well, over the weekend, I came down with the symptoms of the flu. So I self-isolated, and this morning I went and got the test. Now, I'm sure it's just man flu. But if it's not, and I do come back positive, then I'm one of a growing number of Australians who have caught COVID-19 from community spread. In other words, no contact with somebody with COVID-19 or being overseas.
This chart shows the number of community cases in New South Wales where the source of infection can't be identified. This relatively rapid rise in community spread is an underlying concern, despite the good news from the government that the rate of increase in COVID-19 cases has been slowing over the last few days.
This time last week, the rate of increase on cases was up around 25 to 30% a day. That rate now, over the last few days, has fallen to about 13 to 15%.
Part of this has been the testing regime. As of this morning, our latest advice is that there are 209,000 tests that have been completed in Australia, a more than 98% negative rate.
There's no question that in terms of brute numbers, Australia has done a lot of tests compared to other countries. However, the trouble is that the focus of the testing program has been on overseas travellers and COVID-19 contacts. You only see what you measure, and to pick up community spread, you really have to test everyone with symptoms, and that will need the testing infrastructure to be ramped up. Professor Brendan Crabb runs the Burnett Institute in Melbourne and has spent most of his career studying infectious diseases in populations.
The best assessment, I think, of the current data is that the sort of border controls, the restriction on travellers and their contacts is working, and the concern now, of course, is what's happening in the community. There are people in hospital who have had no contact with a traveller or a traveller's contact that we know of. So we assume they're representative of community transmission. The important thing to remember is that they got their infection weeks ago, or at least 10 days or so ago. So that the numbers, if you extrapolate, I would expect are in the hundreds, if not 1,000 or so, people out there in the community.
The government is getting closer to what seems like a full lockdown, with restrictions on the number of people you can have round to your house and isolation of older people to protect their health.
It should be reduced to 2 persons in public spaces and other areas of gathering. People aged 70 and over should stay at home and self-isolate for their own protection.
I think restrictions are good. What I would suggest is that we go as far as we can with suppression mode restrictions.
Professor Crabb says that epidemiologists know from the evidence and experience how to act in these circumstances.
The go hard, go early approach is pretty standard pandemic practice in a circumstance where you don't have the tools to do all the contact tracing in the community, and clearly we don't have those tools at the moment. So it's a perfectly reasonable approach. The approach that the government and the officials are taking at the moment is also a reasonable approach, and they're very good at their job, and I understand why they're doing it. But it is the moment in time, and the only moment we'll have, to be having this debate. And I'd like it to be had, and I'd like it to be had in the open, but this is not some maverick left field idea. This is a mainstream approach to go hard when the numbers are at their lowest.
One of the statistics that's made this situation even more confusing is the case fatality rate. That's the proportion of people who die compared to the total number of people infected. And that percentage has varied a lot around the world.
I think it's very dangerous to make ironclad comparisons between countries. We haven't seen yet in Australia the sort of fatality statistics that have occurred in other countries more broadly throughout the population.
A Lancet paper last week tried to make sense of the mortality rates. Confusion is common in the early stages of a pandemic because the statistics are so uncertain. So the researchers used the Diamond Princess cruise ship as a natural experiment because every case was known and captive on board. The mortality rate from the Diamond Princess was just under 1%, and they were an older, higher risk group of people. So the average is going to be lower than that. Does that mean then that we're panicking over nothing?
The low mortality rate in Australia is a sign of success. Those in authority have done a good job to date, so there's been a lot of testing. That means the denominator is very high. The number of positives relatively is quite low, and so the death rate looks quite low.
Independent experts like Professor Krabs say they need to see the government's modelling in order to properly assess the merits of its current approach.
And today, the Deputy Chief Medical Officer announced that, in fact, that will happen and they will release the modelling later this week.
I think we have been quite open with components of the modelling, but I respect that there is a large number of ways that modelling can be done, and so we need to be more transparent, and we will be.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.